Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's March 12th, and we have a lot to talk about. And the first thing we should talk about is that it's MS Awareness Week. And I think you'd have to agree that by far the most impactful announcement that's going to contribute so much to building awareness of multiple sclerosis is the release of the new MS Prevalence study. Going all the way back to the 1970s, any time that MS has been written about, talked about, or in some way highlighted in the media, the story's been the same. There were about 400,000 people in the U.S. who were living with multiple sclerosis, and we all knew that that number seemed low. It seems like everyone knows someone who's living with MS, but the last time that anyone tried to determine how many people were actually living with MS here in the United States was back in 1975. And an awful lot has changed in the world since 1975, except that number, until just a couple of weeks ago, when the results of a new MS prevalence study were released. And by now, you already know that there aren't 400,000 people living with MS in the United States. Turns out there are almost 1 million people who are living with MS. More than twice as many as had been reported for the last few decades. And that new number changes things. It tells our members of Congress that more resources need to be devoted to solving MS. It tells the research community that more work needs to be done. And it tells organizations like the National MS Society, which funded this study, that more than twice as many people are in need of the kinds of services and support that they're so good at delivering. When I think about that new number, when I consider that there are nearly 1 million people in the U.S. who are living with MS, I think about the 1 million families affected by MS. I think about the family members. I think about the caregivers. So the real number of people who are affected by MS here in the United States actually grows to several million. And that's no small thing. Well, since this is MS Awareness Week, I wanted to use this podcast episode to share a few different perspectives about what the new prevalence number means. The National MS Society funded this study, so the first person I wanted to talk with was Cyndi Zagieboylo, the National MS Society's president and CEO. I caught up with Cyndi a couple of weeks ago during the ACTRIMS Forum. The America's Committee for Treatment and Research in Multiple Sclerosis brought more than 1,100 MS research scientists and clinicians together in Dallas, Texas. And you can be sure that we'll be talking about the research that was shared and the announcements that were made during the conference in upcoming episodes of Real Talk MS. But certainly one of the major conversations taking place during the conference was the impact of the new MS prevalence study. In a moment, we'll get to my conversation with Cyndi Zagieboylo. I'm joined this morning by Cyndi Zagieboylo, the president and CEO of the National MS Society, and we are talking about the startling jump in the prevalence of MS in the United States. Cyndi, what are your impressions of the number that sprang from in the neighborhood of 400,000 people living with MS to almost 1 million people living with MS?
Well, thanks, John. And first, I just want to say how much I admire you and the podcasts that you do. Very, very powerful, and I enjoy listening to them every week. I would say from my perspective, the springing hasn't quite happened like that. We always knew that there were more people. We felt like we knew. We had the gut check that there were more people who have MS. And that's what I've been hearing from a lot of people with multiple sclerosis, that I know that there are more. The number is bigger. What we needed is to have a scientifically justified number so that we could say it with confidence, so that we could be clear about what that number was. We have more than 500,000 people who have let us know that they have MS who are part of the society. So when you have that, we don't know every single person. Not every single person has let us know. I wish they all would and join us and be part of the National MS Society, because we need everybody to do this work. But I would say, no, I was not surprised. Of course, I'd been following the research, and we'd been funding the research all the way along. But it's powerful. It's powerful to have a bigger number.
How do you see this impacting people living with MS, people affected by MS? How do you imagine hearing that they are amongst 1 million people living with MS, and therefore many more family members, friends, caregivers affected by MS? How do you imagine that impacting them?
Well, people have let me know that it feels validating. Some people have let me know that it feels validating, that they are part of a bigger group, that they feel in some ways more supported, and recognizing that there's an opportunity to connect with more people. I think that it can give us a bigger platform and a more powerful space in our advocacy area, where we can talk to our legislators and say, look, this is a bigger problem than previously thought. And the need that we have for clinicians and other people who help people affected by MS make their lives better. We need more people paying attention to this, twice as many as it turns out.
With nearly twice as many, more than twice as many people affected by MS, how will this impact research going forward and the funding that we need for research going forward? It seems to me that up until now, our legislators have funded a problem they thought was 400, 500,000 strong, and now they realize it's twice as big. What does that mean in terms of research?
We know the National Institutes of Health funding for MS research has actually been declining over time in terms of what's been going from the National Institutes of Health toward MS, because there's not a specific pot for MS in the National Institutes of Health. But we're not exactly sure all the reasons it's been declining, but some of it could be because of a decline in the feeling of urgency. Well, this spikes it up, right? To me, and I think to a lot of people, this says, hey, this is not solved. It's bigger than anybody thought, and we need to double the attention to it. You heard from Barry. I know you interviewed her recently, Barry Talente, our Executive Vice President of Advocacy, and she is talking about, we're going on the Hill next week to talk about increasing the congressionally directed MS research funding and bump that up and using this prevalence number as evidence and reason that we needed to do that.
I can't imagine something better timed than going to Congress and being able to say, this is something affecting 1 million people, 1 million families. And it not only impacts people from a health perspective, but there's a societal cost in terms of people who are having difficulty on their job. Both the people who are living with MS and caregivers who need to be available to them are dealing with obstacles having to do with employment and other financially related events that are going to kind of ripple through. So there are so many costs that doubled.
Right. And it's not that the costs actually doubled overnight, but the awareness of those costs and the awareness of the impact on our society has doubled. I think that families who are affected by MS today don't see it as a big jump up or a big move for them personally, but to recognize that they're part of a bigger issue for the society. And it's not just the United States this has had an impact on. As the National MS Society in the United States, we're the largest MS society in the world, and when our number doubles and the understanding of what our number is in the United States doubles, that makes other countries think about, well, I wonder what about here? So the worldwide number, you're going to see a shift there as well, because counting the number of people with MS in the world is a huge, gigantic challenge. And we're going to be supporting the MS International Federation in that work soon.
I thought the same thing. I thought that given the fact the number I hear about worldwide MS prevalence, I've always heard around 2.3 million, something like that. But recognizing that nearly 1 million of those people live here in the U.S., it has to bump that number up.
Oh, there's no doubt. There's no doubt it does. And the MS International Federation is, the National MS Society is a very strong partner in the federation. And they have been moving, or we as the federation have been moving forward that work. And it's very challenging. Providing care for people with MS in some third world countries and places, big countries with huge populations, they're very far behind the United States. It is, and so they don't know numbers in a large part there. So it's just it's huge. I mean, it's going to blow out the number worldwide, and I think that's going to have an effect. It's going to get a lot of people's attention.
Well, I think getting attention is the first step toward getting people to take action, and that's always going to be a good thing. I was talking to someone recently, and they said, with the number being so much larger than what had previously been discussed by legislators, by other organizations, it's going to create greater urgency. It's going to build momentum. And those are two of my listeners' favorite words, urgency and momentum. So this sounds like it's going to help us just move the ball down the field a bit quicker, with a bit more purpose, with a bit more urgency and momentum.
I hope it will also inspire people to join, to come on, to recognize that being counted is really important. And one of the places in the United States, or probably the biggest place in the United States where you can get counted and be part of something, is to join your National MS Society and let us know that you're one of those million. You're one in a million, as we talked about earlier. And that gives us, a power. So we've rallied together. We're hearing messages together. We're moving forward together. So if you know someone who has MS, who's not been part of the National MS Society, I hope you'll encourage them to do that, because they might not think they need us right now, but we need them, and we need that involvement.
I can only add to that. I can tell you that as a family affected by MS, literally the day after my wife's diagnosis, the first thing we did was go to the National MS Society's website and start getting information, checking out the resources, and there's no better place to start. So that's nationalmssociety.org. And I think if you're looking for any aspect of not just information, but support and opportunities for involvement, you're going to find it at that website. Cyndi, thank you so much for taking a few minutes to talk to me.
It was great to be with you. It's always wonderful to be with you, and thank you for having me.
I wanted to drill down further and get the research perspective on the prevalence study. So I sat down with Dr. Bruce Bebo, the Executive Vice President of Research at the National MS Society, to get his perspective. I'm talking with Dr. Bruce Bebo, the Executive Vice President of Research for the National MS Society. And we're talking here today because the MS Society made, I guess, what a lot of people would consider a startling announcement. And I will let Dr. Bebo reiterate that announcement.
Great. Thanks, John. It's great to be with you here today. And I wanted to share that the Society made a significant investment in developing an estimate of the number of people living in the United States living with MS. It's pretty hard to believe that that we haven't been able to, for quite a while, get an accurate estimate of the number of people living with MS in the U.S. It's harder than it sounds like it should be to get that number, but we can talk about how we got there a little bit later if you're interested. But just the big reveal is that there are close to 1 million people in the United States living with MS, which is more than double what we thought there was just a few months ago.
As I said, going from, I guess, what the previous accepted but often looked at a little sideways number was 400,000 or thereabouts. And the reason it was looked at with some skepticism is because that number was a very old number, actually dating back to 1975, I think. So what took us so long to do that new count?
Right. So the old estimate was based on science that was performed in the 70s, and it was updated over the decades with as we had new census data from, our understanding our population. But it's not as easy as you would think to count the number of people in the United States living with MS. We have a fractured healthcare system. People access the system through different insurers, whether it's Medicare or Medicaid or private insurer, or whether you're a veteran through the Veterans Administration. There's so many ways people interact with the healthcare system, and they come into one, part of the system, and they move through the system. There's just not a way to track everyone in the United States. And the federal government does not have any surveillance system for tracking the number of people with any, honestly, neurologic disease in the United States. So it's harder than it sounds, but we don't shy away from difficult or hard problems, particularly when we're trying to answer such an important question about how many people living with MS. And so we do what we do when we have a hard problem. We bring experts into the room, experts in epidemiology and statistics, including scientific experts and people living with MS, to form a task force that developed a methodology for estimating the number of people living with MS.
Can you talk a little bit about what that methodology was? Now that you mentioned how hard it is, I'm anxious to hear how the team went about kind of getting this done.
People might be aware that when you're diagnosed with a condition in the healthcare system, that there are diagnostic codes, numbers that connect you to a diagnosis. So there is a diagnostic code for MS, but just querying different databases for diagnostic codes misses a lot of people, and it doesn't sound like it should be, but it's not accurate. What this group did was develop an algorithm or a formula of different ways a person might interact with the health system living with MS. And there were lots of discussions and lots of iterations of this formula or algorithm. They were tested in a database from a healthcare system where there was a known prevalence of people with MS. And this formula was optimized to be able to pull out as many people, almost all the people in the database with MS, but not confuse them with somebody else that might be living with another related disease. So that's selectivity, selecting them away from people living with maybe a related disease, and sensitivity, being able to pick up everybody in that database. So this formula was developed. It had in the range of 90 to 95% selectivity and sensitivity. So we feel very confident that formula was pulling people out of this test database that were living with MS. And then that formula was applied to a number of other databases that included private insurers, it included Medicare and Medicaid, it included the Veterans Administration. John, we covered about 45% of the population in these databases, and we applied the formula to those databases to get an estimate in that 45%. And then it was extrapolated to the whole country, and that's essentially where the almost 1 million number comes from.
Well, when you say almost 1 million, it sounds very different from around 400,000, around 500,000. And that's been the number that's been used conversationally. It's been the number that we've seen media use. And it's been the number that our legislators have looked at when they've funded MS research. How do you see this number changing the conversation in Washington, D.C. when it comes to funding next stage MS research?
It becomes a more prevalent condition in the United States and a more serious problem as a consequence of this new understanding of the number of people living in the United States. So it creates a sense of urgency in our advocacy work to change the landscape for people living with MS. So I know that we will be using those numbers when we are advocating for increased research, funding for research from the NIH, and also we'll be using this new understanding of the prevalence of MS to advocate for more spending by the Congressionally Directed Medical Research Program on MS research. And I hope that this new understanding will inspire, or I'm not sure what the adjective is, force our government to invest more resources in MS research.
As we're talking about the federal government, one of the wins that MS advocates are celebrating right now is the funding of the new National Neurological Condition Surveillance System. How will that going forward help us keep better track of the number than we've been able to do for the past couple of decades?
Right, great question. So the society and our advocates have for more than a decade advocated for this national neurologic diseases surveillance system, and finally, a couple of years ago, had a tremendous success with getting this surveillance system legislated as part of the 21st Century Cures Act. Of course, there are two steps you have to go through in order to get something like that off the ground. You have to get it legislated, and you also have to get it appropriated or funded. So just a year or so ago, again, through the effort of thousands of society and advocates were able to secure appropriation or funding for this registry or their surveillance system that will be led by, coordinated by the Centers for Disease Control. So this is a tremendous victory for people living with MS that the federal government will now start to count or surveil the country for people living with MS. We have been partnering with the Centers for Disease Control all along the development of this new prevalence number. We've coordinated and had conversations with the folks at CDC that work in this area. So they're quite aware of the direction that we've taken in parallel to advocating for this surveillance system. And so we're going to start this new, I'd say, effort at the CDC way ahead of the game, because we've already spent the last couple of years developing the methodology that can be applied to other sources of information that the CDC has access to that we might not have access to. So I'm hoping or expecting that our interactions and collaboration with the CDC on the surveillance system will help us be able to dig in a little bit more into the demographics of MS. So the work that we've done tells us how many people are living with MS. We have some general sense for where geographically they're living. We understand the gender differences, which were about 3-to-1, which is more what we've seen from other studies. But we don't really have detailed demographics. We don't have information on race or ethnicity. We don't have information on real precise, geography. And that kind of level of detail that can really reveal insights into what triggers for MS or causes for MS. And that's what I'm expecting our work with the CDC on the surveillance system is going to get us that detailed information that we need.
We've talked a little bit about how this new higher prevalence number, considerably higher prevalence number, is hopefully going to impact our legislators. Can imagine how it's going to impact people who are living with MS and affected by MS. Is it going to have any impact on the research community that you can see?
Yes. So the short answer is yes, but I think you probably want the long answer, John. And, I think it affects research in a few ways. One, it does create that sense of urgency that this is a bigger problem than we thought it was. And it creates momentum and urgency among the scientific community to prioritize questions that are important to understand in MS. I think that technically the prevalence data will become more valuable to the research community once we're able to dig into the demographics a little bit more. When we can see who is and what the sort of characteristics of people with MS, and we can learn a little bit more about triggers for MS and about understanding what those triggers are and being able to potentially, John, I think, mitigating exposure to some of these triggers and perhaps reducing the prevalence of MS as a consequence of this new knowledge that we'll have. We won't know if we're making progress, right, on reducing the numbers of people getting MS unless we know how many people actually living with MS in the first place.
You use the words urgency and momentum, which are two of my listeners' favorite words. So I appreciate that. Dr. Bruce Bebo, thank you so much for your time today.
It's great to be here with you, John. Thanks.
When you can't knock on every door in America and ask if someone has MS, how do you go about getting an accurate count? Well, I met up with Dr. Ruth Ann Mary, one of the lead investigators in the Prevalence study, and I asked Dr. Mary to break down what I thought was just a remarkable methodology that was developed for the study. And while we were talking, I had an opportunity to ask Dr. Mary about another subject that I knew was a major focus of her MS research efforts. I'm talking with Dr. Ruth Ann Mary, a professor of medicine and community health sciences at University of Manitoba, and one of the investigators involved in the actual research behind the prevalence numbers that we've been discussing. So first, thank you so much for taking a few minutes to chat today. Dr. Mary, and tell us a little bit about your role in this study.
Thanks for inviting me to talk to you. Very excited, along with the rest of the team, to be able to share the unique approach that we use to be able to better estimate the number of people who are affected by MS in the United States. So unlike countries like Canada, which have a universal health system, in the United States, you have a variety of different types of health insurance, and so you can't easily capture all of the people with MS either using health insurance data or by just going door to door and trying to count people. So we thought very carefully about a way that we could overcome this challenge. The first thought that we had is that everybody with MS, with the exception of those who don't have any health insurance, live in some health insurance bin. So that could be that you have private commercial claims health insurance. You could be insured by the Veterans Administration because you're military or military-related family, or you might be covered by Medicare, Medicaid. So we also thought that we know roughly in the United States, based on surveys that are done periodically, we know what proportion of people in the United States are covered in each of those insurance bins. So we thought if we could find a way to accurately identify people with MS in each of those bins, we could then look at what proportion of the population should be covered by that and roll those numbers up together to come up with a final total number. But then you would say, well, how do you know that somebody has MS in one of those health insurance bins? And I would say to you, well, it takes some effort, and this is a big part of what our study did. So there have been methods applied using the Veterans Administration data, as well as in Canada and some other countries where you have health insurance information about pretty much everyone in the population, where there has been work showing you can accurately identify people with MS. So one of the approaches that you have to do first is identify some people where you're really confident they have MS. You've got their medical records, and you know for certain, based on reviewing their neurologist notes and their neurologic exams and whether or not they've had spinal taps and their MRI results, you are confident that this person has MS. You also need to have some people that you're confident don't have MS for comparison. And then, if you can get permission from those individuals to link their clinical data to their health insurance data, you can begin to look at a way of figuring out what the health insurance data has to tell you in order for you to know that someone has MS. So, for example, every time you see a healthcare provider or you're hospitalized, somebody submits a billing claim. And on that claim, they have to justify why the bill is going in, and so a diagnosis code goes on there. So if you're seeing someone for MS, somebody puts in a code that's MS, and that actually has a number. We also know just because somebody puts in a code of MS, it doesn't necessarily mean that you have MS. It might mean somebody wants to rule out MS as a possibility for why you have numbness or visual loss. So we thought that if we put the two together, records of people who didn't have MS, and we looked at people's health claims use, we could figure out what the pattern of healthcare use had to be to predict accurately that somebody had MS. And so it turns out that if you have at least 3 health insurance contacts for MS in a year, then we can be quite confident that you do have MS. Those contacts could be a doctor's visit or a hospitalization or a prescription for an MS-specific disease-modifying therapy, and in any combination. You might say, well, but do they do the same thing in the VA as they do in Medicare, Medicaid? How do you know that this stuff all works equally well in all of these health insurance bins? And we'd say, absolutely, this is a potential problem. So what we did was test that out in 3 different health systems. So we looked at data from Kaiser Permanente in California, the Veterans Administration data, we had access to these clinical records, and we looked in Canada as a completely different health system in the province of Manitoba, where I'm from. And we thought if we could show that this approach worked equally well in 3 very disparate systems, it would be very reasonable to say it worked actually in all of the health claims data sets, even if we couldn't actually do that same kind of direct verification. And as it turns out, they were remarkably similar, so we felt very confident applying that to all of those different data sets. And then we were able to move forward in terms of generating the numbers in each data set and rolling them up to come up with our number.
Wow. That is quite an amazing methodology. How long did this entire process take you?
Well, it took quite a long time. If you go from, the conceptualization of the idea to actually working it out, then to executing it and then pulling it all together, several years.
Certainly sounds like time well spent in terms of coming up with a result that I think has been reaffirming to a lot of people and yet eye-opening as well. And certainly I know everybody in the U.S. now who's living with MS can actually say they are 1 in a million. So thank you so much for the effort that you put into to make this study viable and to give us the results that are going to impact so many areas of research and funding and just raising the profile of something that we all knew was a problem, and turns out the problem is, well, twice as intense as it was before. So I appreciate that. If we can deviate slightly from the path of prevalence of MS in the U.S., I know another area that is a real research focus of yours has been on the role of comorbidities in multiple sclerosis. Can you talk a little bit about some of that?
So first, I think we should make clear to people what we mean by the term comorbidity. So it's really coexisting health conditions in someone with multiple sclerosis. So it would be something like diabetes or high blood pressure or high cholesterol. We have learned in the last few years that these are also very common in people with MS. And just like people without MS, they become more common as we get older. Why should we care about these coexisting health conditions? Well, we've learned that they actually affect MS a lot. So having multiple coexisting health conditions or comorbidities is associated with people having faster disability progression, worse quality of life, worse pain and fatigue, and a number of other impacts that are important to people's everyday lives. Often when I tell people this, they become a bit distressed because they're like, well, I already have to worry about my MS, and now you're telling me I have to worry about all my other health conditions too. But I like to think about it from a different perspective, which is we actually just learned about a whole lot of other opportunities that may allow you to improve your MS. So things that help us prevent those other health conditions, like being physically active and eating a healthy diet, achieving a healthy weight, will reduce the risk of those conditions, take care of them, but they're also really good for your MS as well. And possibly taking care of those other health conditions well will actually improve your MS outcomes. So I think of it, in 2 directions. We need to learn more about these things. We also need to do a much better job in recognizing that this is an opportunity to make things better.
Well, this sounds really interesting and important in the sense that while people may not be able to go out and do anything to cure their own MS, there are lifestyle choices that they can take an active role in that can improve their overall situation.
Absolutely. I think there are lots of things that are, in the person with MS's control. And so even when you think about physical activity and somebody says, well, I get tired too quickly, I can't do 30 minutes. I was like, well, 5 minutes, if you can tolerate that, is actually better than no minutes, right? And it's not an all or none package. If you're in a wheelchair, there's still physical activity that you can do, and there are physiotherapists who can help you design a program so that you can continue to exercise despite those limitations. Most of us can do better with healthy eating, and there are, again, tools that can help us do that, apps that help you track what you're eating, can help your family members, encourage you to make healthier choices. So I think there are lots of opportunities.
Well, thanks again for sharing that. And thank you for all the work that you're doing to help improve the quality of life for people living with MS. Dr. Ruth Ann Mary, thanks for taking the time to talk with me today.
Thank you. It was my pleasure.
After the ACTRIMS Forum in Dallas, I flew to Washington, D.C. to participate in the National MS Society's Public Policy Conference. This event culminates with our Day on the Hill, when about 300 MS activists visit with members of Congress to help them better understand the issues that are most important to people affected by MS and to ask them to support legislation designed to improve the lives of people affected by MS. Well, you can be sure that virtually every one of those conversations included the new MS prevalence number. I also took the opportunity of being at the public policy conference to ask some of the conference attendees to share their thoughts about this dramatic increase in MS prevalence. I met up with Tammy Ryan, who was diagnosed with MS in 2005. Tammy's an MS ambassador and an MS activist from Texas, and I asked Tammy to share her thoughts about the new MS prevalence number.
400,000 has been a low number for a very long time. MS has been out there for 50 plus years, and the National MS Society has done a great job in really responding to people with MS. But the response has been based on a number that's not realistic, right? So now that we know that there's a greater number of people with the disease, we've got a greater chance to have more impact and share our stories and also connect with those individuals in research, in programs, and finding cures for them and treating their symptoms.
I also talked with Dan and Jennifer Digman. Dan and Jennifer have been guests on the podcast before. They're just a remarkable couple from Michigan. Jennifer was diagnosed with secondary progressive MS in 1997, and Dan was diagnosed with relapsing remitting MS in the year 2000. They met at a National MS Society event in 2002, and they were married in 2005. While we were together in Washington, I asked Dan and Jennifer to share their thoughts about the new MS prevalence number.
We've talked for years to say it just seems like there's way more than 400,000 people, because I think every time you tell somebody you have multiple sclerosis, everybody had a relative, a brother, a cousin, somebody else who had MS. And I'm thinking certainly there has to be more. And I just think the impact of what this means for the MS community, there's strengths in numbers. And now we have that many more numbers to speak about.
Jennifer, tell me a little bit about what you think about the impact of this number, this almost 1 million people across the country living with MS.
I'm agreeing with my husband, Dan, and I'm saying, well, duh. Finally, we've been saying that for 20 years. Maybe not that long, but we have been saying the number is larger. And I like the idea that each of us living with multiple sclerosis are 1 in a million.
While I was at the public policy conference, I also met up with Karen Jackson. Karen is just a tireless leader in the MS advocacy community. And here's what she had to say about the new MS prevalence number.
I think there are 2 words that come to mind. One is validation, and the second is ripple effect, because I think besides 1 million of us that actually are living with MS, the ripple effect is how many people, so you can probably triple or quadruple that number as far as how it affects the family members. So therefore, we're looking at 4 million people that are affected by this number.
The Oxford Dictionary defines awareness as having knowledge or perception of a situation or a fact. And for MS Awareness Week 2019, the perception of MS in the United States has changed. People living with MS are living with a disease that brings an unpredictable set of symptoms and progresses at an unpredictable rate. It's a disease that demands more resources aimed at creating better treatments while looking for a cure. And now we know we have about 1 million good reasons why that has to happen sooner rather than later. Well, that's going to wrap up this episode of Real Talk MS. Just a reminder that your feedback, your questions, and suggestions for future podcast episodes are important to me. That's why, in addition to emailing me at john@realtalkms.com, that's JON@realtalkms.com, you can also call the special listener hotline that I set up specifically to capture your comments and suggestions. Just call area code 310-526-2283 in the United States and share your thoughts. So whether you choose to shoot me an email or make a phone call, I hope you'll get in touch and join our conversation. My name is John Strum. Thanks for listening, and we'll catch you next time.